Next, we're going to look at movement patterns and motor learning. The Air Force designed an acronym called UDA, which breaks down how we make decisions. This was especially important for World War II pilots. So, the pilot would observe the enemy. Next, they would orient their aircraft to the enemy and get the enemy in their sights. Then they would have to decide when to shoot, all the while deciding on how the altitude was and looking at other factors that are occurring simultaneously. For instance, the tail gunner might be having some problems, or there might be an engine out. The next skill set continuum we're going to look at is precise movements versus gross movements. The first continuum is fine motor movements. So imagine we're throwing a suture. We have to think about moving the swag at 90 degrees, bringing it into the skin, how much pressure we're getting, and then retrieving it. At the other end of the spectrum is gross motor movements. Here we see a gold medal performance by swimmer Michael Phelps in the butterfly. At one end of the continuity continuum, we have discrete movements versus the continuous movements of skiing, where you feel that constant feedback of pressure. Now we're going to review the case of a sural nerve entrapment. To the left of the screen here, we have the Achilles tendon with the surrounding fluid, and right up at the top in that yellow border, we have the sural nerve. We can see the sural nerve is a little flattish, and now we've brought the Doppler in to take a look at the vessels surrounding the sural nerve. Now the sural nerve is still in yellow, and there's going to be the introduction of the fluid to expand the area around the epineuron and the surrounding space, so that now we'll see that the sural nerve takes on more of a roundish shape as the fluid is introduced. This was a case by a colleague of mine, Dr. Gary Ho, and he does a lot of this. And what he's finding is that after he is able to get that nerve visually to a more roundish shape, the function of the nerve improves. Looking at a case of a foot drop injury from an ankle sprain. So sometimes what happens is the peroneal nerve, as it wraps just behind the fibula in the knee, will be traumatized, resulting in a foot drop like we see over in the picture here. Now, what does that foot drop mean? It means that it's very hard to lift up the toes, okay? So what's the reason? Sometimes there'll be a resultant scar tissue that hooks up on the peroneal nerve as it crests around the fibula head up in the knee. And sometimes it's the result of just an engorgement of the nerve. So if there's an engorgement of the nerve, how do we deal with that? What is a way we can non-surgically address that? Well, one way is with something called pulsed electric magnetic field. And what that does is it engages the nerve, it stimulates the nerve, it helps with cell permeability to improve the condition and the status of the nerve, thereby helping to fire the nerve more effectively. We're going to look at an example of a patient that has sustained that foot drop injury 3 months ago. And nothing has really improved it except for the fact that now we are waking up the nerve with the PEMF treatments. I'm going to shift over and segment the treatment that he did, and we'll look at the current state of his dorsiflexion or ability to move the toes upward. So here's the key find. Even though it doesn't look like a lot, my patient was not able to do that last time. I'm going to let you sort of describe it in your words, this wake-up process, what you've experienced from treatment number 1 now to treatment number 2. And we did run it, by the way. We ran that PEMF all the way down to the length of the peroneal into the ankle as well.
So the first time I was here, I could not move my foot at all up, and I felt no control at all of my toes moving up. And when I had this treatment the first time, I didn't have the same sensation that I had the second time, and now I can see, I guess these are tendons being activated when I try and move my toes up. There's not a lot of movement, but this is compared to what it was last time. This is giving me hope.
Yeah, and that's great. You know, these things, as we mentioned, by their normal healing trajectory can be up to 2 years to heal. So it's already been 3 months for you, and we're hoping that with this jump start of sorts, we're going to shrink that hopefully to just a couple more months. So the real question is, what do we do with frequency? I'm going to suggest we try to see if we can engage this twice a week if possible. And then we'll talk about some other options if it, particularly since we've had some early significant success. I mean, to me, this is like at least about 20% to 25% better than where you were, which, for slogging on with no change is a big delta.
Mm-hmm.
All right, we'll continue to follow up. That does look better. Less of a giddy up for sure. That is good. For this last segment, we're going to take a look at some amazing things that happen with our neurocircuitry. Let's take the example of someone that has had an injury that has limited them from partaking in normal walking or even being able to grip something with their hand. As we see in this short 60-minute segment, there are now neural implants that literally will fire those missing motor connections in our brain to be able to affect a movement pattern.
The ports in his skull communicate the brain's intention to a robot arm, and then the sensors in the robot hand send the feeling of touch back into Embry's brain. We also met a young man named Austin Beggin. He became a quadriplegic after diving into a submerged sandbar, but now he's involved in some of the most fascinating research that we saw while shooting this story. Like Scott Embry, he has ports in his skull that connect to his brain, but unlike Scott Embry, the signals for motor control go not to a robot arm, but to his own arm, to sensors inside his arm that fire his muscles. This allowed Austin to do something that he hadn't been able to do in years, and that was shake his father's hand.
You can definitely feel the squeeze.
Yeah, I got a good grip of it.
Amazing.
Yeah. I mean, it was the moment that kind of summed up to me why I even did this.